Hi everybody, you're welcome to Chrissy's Educative Talks. Today on Chrissy's Educative Talks, we'll be talking about urinary tract infections. What are urinary tract infections? So urinary tract infections are infections of the urinary system. So our body is made up of a variety of systems. We have the respiratory system, the digestive system, the integumentary system, and the urinary system is one of these systems. The urinary system is made up of four main parts: the kidneys, the ureter, the bladder, and the urethra. So the kidneys are involved with filtering of blood, and they send out the waste as urine through the ureters. The ureters send it to the bladder for temporal storage, and the bladder sends it out of the body through the urethra. So urinary tract infections mostly affect women than men. Why? Because of the woman's anatomy. So in the female system, the female's urethra is usually shorter and closer to the anus than that of the male. The male urethra is longer and far from the anus. And at the level of the large intestine, remember the anus is the outlet for the large intestine. In the large intestine, we have a group of bacteria that are called normal flora. What is normal flora? So the normal flora is a group of microorganisms that live in the human being. They both benefit from each other without anybody causing harm to either partner. So E. coli is that normal flora found at the level of the large intestine. And this E. coli helps the human body by producing vitamin B12, which is very much needed by the human body. And E. coli again also occupies space in the large intestines, preventing other microorganisms from infesting the large intestine. What causes urinary tract infections at the level of the bladder? So at the level of the bladder, most of the infections here are due to the bacteria E. coli, because like I said, the urethra is just close to the anus. So E. coli bacteria leaves the anus, enters through the urethra, and infects the bladder. And when it infects the bladder, it leaves us with urinary tract infections. Again, a cause of urinary tract infections can be at the level of the urethra. And at this level, most of the causes are due to sexual transmitted diseases like chlamydia, gonorrhea, herpes, mycoplasma. Those are what causes urinary tract infections at the level of the urethra. What are the symptoms of urinary tract infections? We have one, frequent urination. So you drink water, and before you know it, you've drank just a glass of water and you're going to pee like 3 times, 4 times a day. You should already start thinking that you could be suffering from urinary tract infections. The next one is painful urination. So even when you go to pass out urine, the urine is very painful. The next one is the color of the urine. So the urine is usually red in color, black in color, or dark brown in color. You should already start suspecting urinary tract infection. And again, very little urine is passed out when a person is infected with urinary tract infections. Can urinary tract infections be treated? Yes, they can be treated. All you have to do is go to the hospital, tell your doctor what's up with you, and he's going to send you for a series of laboratory tests. And if your test turns out positive for urinary tract infections, then he's going to prescribe you a few antibiotics depending on the cause of the urinary tract infections. Again, at the level of the urethra, there are a group of normal flora bacteria. They're called lactobacillus. Lactobacillus helps us to occupy space in the urethra, and because they occupy space, no other bacteria can come in because they're already occupying the space at that particular habitat. So if this lactobacillus is displaced, then it's going to give room for other bacteria to come in and infect the urethra. And if that happens, we are going to suffer from urinary tract infections. So how can we prevent urinary tract infections? Always empty your bladder. Always empty your bladder, especially after sexual intercourse. But if you urinate immediately after sexual intercourse, you're liable to flush out the bacteria, and you can reduce your chances of developing urinary tract infections. Again, when using the toilet, especially when we want to stool, it's advisable to wipe from front to back and not back to front, because when you wipe from back to front, you carry bacteria from the anus and take them to the urethra, and when you do so, you're exposing yourself to urinary tract infections. The next thing is, always make sure when bathing you do not douche, because when you douching means you use your fingers to wash inside. When you douche, you displace the lactobacillus, and when you displace the lactobacillus, it makes the environment good for other bacteria to infect the urethra, and when you do so, you'll be putting yourself at risk of urinary tract infections. So thank you very much. That's all I have for you for urinary tract infections today. Stay tuned always on Chrissy's Educative Talks. Follow us on YouTube, follow us on Instagram, follow us on TikTok, follow us on Facebook as well. Hope you stay tuned to more videos. Love you.